morning, everyone. How is everybody doing today? Oh my God, it's Squid. Welcome back to my channel. And I am here with Sarah from Livin Life with FND. You can tell, apparently you can tell how old somebody is when they do this. They're older. This is like the new thing.
And I learned that you can do that, and then it'll show the hearts and all this jazz.
I know. Hey, Flash fan, how are you this morning? Please like, sub, and share. This is an awesome community. Thank you. Flash fan is like the best mod in that. Like, there's mod kings and mod queens on YouTube, and I have 2 mod kings and a mod queen, and they are awesome, and I love them. Like, Bearded Man Steve, how are you? Papa Squid, good morning, all. Boy, I really do need more coffee. Yeah, last night was kind of a rough night. The little wasn't feeling good last night. She slept fine. Don't get me wrong. I did not sleep because I kept waking up every hour, making sure that she was okay. So we're having a thing. Oh, the good Bruce is here. Bruce from Oregon. Like, how are you, Bruce? I call him the good Bruce because we all know the not good Bruce. You know, Yvonne, good morning. Gail, howdy. Long time no chat. We were together in Spawn's chat a little while ago. Yeah, I received a message this morning, Flash fan, so I already kind of know the situation. But yeah, we have to talk. Yeah, somebody decided to try to troll Flash fan again last night and in somebody else's chat, and no, somebody tried that before. Somebody tried that before, and it didn't work. And you know what? I realized when I was running out of the room to get something, I didn't grab my phone. I was going to do a hater of the day segment right away because I got a hater comment overnight that says no matter how many, something about no matter how many times I drop or the R word gets dropped on my stream, I just use, I keep deflecting, and I'm a grifter. And it's like, I have my medical dictionary, and I'm just making sure that this is actually, because I know people get offended by the word that starts with an R. However, it is an actual definition. And yes, it is hijacked by people, but it is an actual medical definition. I'm just in I forgot how to look in the dictionary for a second. And I forgot to do it before we started because it's an actual medical definition. And it's just one of those, it's right here, it's at the top of the page. Sometimes offensive, slow or limited in intellectual or emotional development, characterized by mental so slow or limited development is what that word actually means. So it does have a definition, sometimes offensive, but I was taught when I was little that sticks and stones may break my bones, but words can never hurt me. So you will hear things on this channel that you may not agree with. And that, guess what? People say things that we don't agree with all the time. And guess what? The world keeps on turning. And we are all still okay. So, and just remember, nobody that comes on this channel speaks for me, and I don't speak for anybody else. So there's that.
Exactly.
Yay, Jude! Surgery was successful. Good. I was going to give you a couple of days. I was going to respond to I know that you had emailed me a couple weeks ago, so I had your contact information, and I was going to email you back today because I wanted to give you a day or two to, like, you know, you don't need to be bombarded with messages of like, are you okay? Like, I'll give you a day or two to like rest, figure out your new routine, go home from the hospital if you were there, and then I would message you. I'm not that I'm not that type of person that like tries to bombard people with like, are you okay messages all the time. I'm bad at that. So and Flash fan, thank you for being a member for 3 months. Y'all are awesome. I appreciate y'all. I appreciate you too. I don't know where I'd be without you. All right. So this is a new I've been talking about wanting to do this series for a while, and finally I'm making it happen with the help of Sarah.
Yay!
This is I did a members only stream, which I will make public in a couple days, where I talked about my personal journey and what I've been through and being gaslit with a chronic condition, not getting a diagnosis right away, being told that I'm faking it by coworkers when I worked in a hospital, and my coworkers even thought that I was faking it. So the as helpful as the medical community is and as smart as they are, sometimes they don't know a lot about certain things. And yeah, I was made to feel like I was alone. And with this whole YouTube community, starting in Megan's stream during the Maya Kowalski trial, when people were telling their stories, I realized that I wasn't alone. And I kind of want to show the people who have always had good experiences that in our healthcare system, that your experience is not always the case. Not everybody has a good experience. And I also want to tell the people who have had bad experiences that you are not alone either. And just because you have had a bad experience, you are not alone. You are not, there are people out there that can talk to you that have similar experiences, and kind of wanted to bring everybody together. So I kind of made it happen. And I figured, who better to start with than the person who has shared their extremely personal journey with me. We haven't talked about it a lot, but she started her own channel and changed her name on YouTube to Livin Life with FND. So I want people to tell their stories in their own words, so I don't speak for people. That's the whole point. I don't speak for people. I let people speak for themselves. So Sarah, I want you to introduce yourself. I'm going to run and grab my phone while you do that.
Okay.
And we will get going.
Hello, beautiful people. I hope you're doing well. I want to thank you so much for having me, Squid. It's certainly been quite the journey. As you guys all know, I'm Sarah. I'm gonna kind of dive in and tell you just a little bit about me, and then we'll dive into how I was diagnosed with FND, and so I'm gonna I got bullet points here to kind of keep me on track, because as you know, both of our channels, we derail. So I'm not ignoring you. I'm just trying to, kind of go with the my bullet points, keep on topic. I am Sarah again, and I was pretty much a successful entrepreneur. Now I'm a funpreneur. I sound like I have gas, but anyways, you can make fun of that. I'm a medical massage technician. I've been in this profession for almost 20 years. The medical massage program was a year program. With my learning difficulties, it took me roughly about 3 years. I started my first business at the age of 10 as a babysitter. And so I was like, I want to start my own medical massage practice. So with the owner, the founder of my school's permission, I guess you would say, he let me do my own internship, and I have ran 5 practices over the years. So,
And And I just have a question for you, because I have done medical massage therapy for chronic pain in the past, and it has worked beautifully. Unfortunately, the VA kind of screwed me over in how they redid their process, so I had to go through some hoops, and now my person is no longer working with the VA, and I'm like, what is medical massage?
Medical massage is geared towards chronic health issues or limitations. I practice manual therapy, so it's more between relaxation massage, spa massage, and physical therapist. So I'm kind of in the, I have to go with the massage license since there's not really a category for manual therapy. And I don't qualify as a physical therapist. So it kind of intertwines, you know, chiropractors do like manual therapy, physical therapy. Physical therapists do occupational. So I'm kind of in that in the middle of everybody. So
I like to say you catch the people that aren't low enough physically to get physical therapy and qualify for PT, but not high enough to function in their daily lives without chronic pain and issues. And I like to, it's the catch-all of people who are that in between and kind of fall through the cracks with their pain. They're not low enough to get PT because PT has to be a skilled service. OT has to be a skilled service. But are too low level to function and to have too much pain to be able to do their daily tasks without interference.
Yeah.
And I am pinning Flash Fan put her link in the chat. I have it in the description of the video too, for those of you on replay crew, but I will put it in the I will pin it to the top of the chat. She is at 88 subscribers last time I checked. If we can get her over 100 today, that would be amazing. Amazing.
Yeah.
Amazing. Her first milestone.
I would celebrate. Yeah, this is pretty exciting, to do. And my dad's like my number one, cheerleader in this journey. So he's been my big supporter. So he gets the updates and he always asks me, how many subscribers do you have now?
My dad checks on mine too. My dad goes, look at your subscribers. Like, what made you want to start a YouTube channel?
I've been a funpreneur now. I'm like, how can I make this, I can't work right now, a real job. I physically can't do massage therapy right now, nor do I want to do it right now either, because I just find it's unethical, because I'm not, physically, and this has brought a lot of mental, stuff. So I'm like, what can I do now? And I've dabbled in YouTube in the past, and I absolutely love it. I'm kind of a geek. So I get that, from my father. I definitely did not get that from my mother. My mother, was not tech savvy. Like, every time she would use a computer, how do you turn this on again?
I love Mama Squid, and Mama Squid, when you watch this, I love you dearly, but tech savvy is not your area of expertise. It is, however, Dad's. Um, so my mom is good at what she's good at, but technology is not exactly one of them. But my dad has always been the technological side and my go-to IT guy. I love you, Brad, but my dad's been my IT guy since I was 2.
And two, my mom passed away in 2009, and I kind of wanted to bring her legacy into this as well. She was a double major in English and psychology, and so I think uh, that resonates, with me a lot. So, trying to bring her, back to life. And two, I had a family member who attempted suicide. So I wanted to bring that to light as well, and that this whole journey has impacted my mental health. So I wanted to shed light on that as well. You really, when you have chronic health issues and you get kind of suckered into this sinkhole and you feeling like you're the only one, and so I'm like, okay, I need to tell my story, and if it helps somebody out there, you know I'm golden.
That's kind of
And
how I feel as well. If I can let someone know that they're not alone, and figure out ways to cope and just help someone's mental health, because like chronic pain does a number on you. Like
yeah,
it's not just mental pain, it's like physical pain, it's mental pain. Because when people just don't believe you and you're like,
and
just because you
and
can
this
see someone.
family member that attempted suicide, I saw the impact the night before it happened, and I'm like, I wish I could have, should have done this, and um, so that impacts me quite a bit. And so I'm kind of derailing here.
You're
And
fine.
then I'm like, I've seen too much abuse and neglect. I've dealt with abuse and neglect, and it needs to stop in healthcare. And I want to shed light on that. And the stuff that has happened to me during this should have never happened. Um, it, yeah, and it's
So
so frustrating.
getting back to that and the very beginning, what were you experiencing before you got a diagnosis, or before you went to a doctor to say, hey, this is happening? What was kind of going on in your life?
Before I fell on the sidewalk. I was taking a walk. Life was going really, really good. Like, I opened my practice up again after the pandemic shutting us down. Um, I was, doing jujitsu. I was
Oh,
doing
I knew I loved
all,
you.
all the.
I'm just a 2-stripe white belt, but I knew I loved you.
Okay.
Sorry, derailed.
Derail. The cuteness. Derail. So just I was hustling, doing art, living the dream, like. And 1 month after I opened my practice, I fell. And I didn't think much of it. I should have called the ambulance to, have it on record. And I went to urgent care, but we never thought, to think about, concussion.
No, that's that.
I scuffed up my knees, especially on my left side. And that is the side that has been impacted. And then, it took about 2 months, and I was like, am I having medication issues? Or am I having anxiety, PTSD? Before Vraylar came into my life, I was taking microdose of Vraylar, and I was seeing this. He was kind of retired, but still practicing. I got kind of tired of, going to this doctor, that doctor, nobody knowing anything. So he put me on a very microdose of Vraylar and listened to me for almost 2 hours. You don't hear that in.
Wait, you found a doctor to listen to you for 2 hours?
Yeah.
How many doctors had you seen before you found this one?
Oh, I've seen doctors out of the wazoo. And so he cost too much money, and I was trying to get my practice, started, and I knew I needed something for, some chemical balancing act with this anxiety, PTSD that had been brewing for many years. But I noticed the Vraylar it was something that I needed, and it really worked. I was slowly seeing improvements, and the PTSD, anxiety was just like, dissipating, I guess I would say. And so zoom back to when I fell, 2 months, I was starting to have anxiety and PTSD issues and the night terrors. So I was like, okay, I can't go see this doctor. I don't have the funds to see him. I need to go admit myself and maybe adjust this medication. And and I've been there before, and having sensitivities to medication, like severe interactions with psych meds, any meds in general. I was like, I need supervision. I don't like the side effects. And I got admitted. The nurse there kept telling me to stop crying, and sorry, my voice is like dying.
No, you're fine. At this point, at this point, it had been, you said, about 2 months of dealing with side effects and things. And
Yeah.
what did they? I'm sorry, she's had a cold, and if you hear me cough, I apologize. I try to mute myself, but it doesn't always work. Did you go to an ER, or was this a?
No, I went to, and I should have gone to the ER, but I was so impaired that day, and I only knew how to drive to like hospital, and there are a lot of problems with this hospital. The outside phone was broken. It wouldn't dial in. They were locked up regardless of being 24 hours, open 24 hours. I mean, this was like, I'm going to say 6, 7, 8 o'clock. I understand if you have to lock up at 11 to 6, for your employees' safety, but it took about 20 minutes. I want to call for me to stand there and for somebody to walk past and notice me. There was nobody in the reception area, and I know I should have gone to or called or whatever, the ambulance, but I didn't have cell service.
When you got there and they finally got you admitted, they told you to stop crying?
Yeah, she sat me there. I was like, I need to take, my medication, the Vraylar, and I needed something to relieve this anxiety, PTSD. I didn't care if it was like herbal tea, sleepy tea, or melatonin or something. I needed some sleep. I hadn't slept for like 2 months, and I want to say I really got really concerning and bad on that Sunday. I admitted myself on Wednesday when I was like, okay, nothing's working. Coping skills were not working. Jiu-jitsu was not working. Working more hours or less hours, sleeping, you name it, running on the treadmill. I tried it. Ice baths, cold showers. Nothing was working. Like, and I didn't feel safe to up my medication without supervision.
Yeah, that's never. I don't provide medical advice on this channel. However, that is one of the things that is generally not encouraged by anybody, is to adjust your medication doses by yourself. That is not medical advice. That is general life advice. Talk to people.
Yeah. So.
Angel.
And even if I called my therapist, he would have, sent me to the hospital or had a wellness check or whatever, and would have been like, go to this place. But I wanted to stay close to family, and since I had a business, I wanted to stay local. I didn't want to be shipped off, an hour, 3 hours away or whatever. So that was important. That way my support could, come and visit and show their support and love while I was in the hospital. But also, that way I could still somewhat conduct business, the best way I could. And that's the other problem is like mental health is so stigmatized, and and we're led to believe that oh, you got to be hush hush about your mental health. And after the pandemic, we all need to realize that we need to, it is what it is, and love and support each other, and get rid of the stigma. So
it's one of those things that you can't see, but everybody has. Like, everybody deals with some level of anxiety. Everybody deals with some level. So when people say, well, you have nothing to be depressed about, or you have nothing to be anxious about, it's like, well, I recognize that my anxiety is irrational. That's why it's a problem, because everybody has some level of anxiety. It's when your anxiety, depression, when things become, everybody has a bad dream every now and then. But when you have a bad dream every night, that's when it becomes a problem. And I know that my anxiety is irrational. Like, I had art therapy yesterday. I didn't know nothing makes me more anxious than art therapy. But we had a thing where we had to draw something, and she made us tear it up and then make something new. And I had no idea what to draw new, because I knew what I drew was an irrational fear. So I taped everything down, or I glued everything down and wrote all the words why that was an irrational issue. And it was like, the part of being anxious or depressed is that it's irrational. Your body just can't do anything about it.
Right.
But most people can go, yeah, that makes me anxious. I think about something else, or I can do something to distract myself, and it goes away. When you have anxiety or PTSD, no matter what you do, it still does not go away. And that's when it becomes an issue. And it's like, when people have said, well, you have nothing to be depressed about. I know. I'm well aware, but my brain tells me otherwise. Like, there's this discrepancy between what I know is rational and what is actually happening. It's like, it's like the toddler brain when she bumps her knee and she thinks it's the end of the world because she's never felt that pain before. And like in 5 minutes, she's fine because she realizes that it goes away. Well, it's that she bumps her knee and that pain never goes away. And it lingers there for months. That's the best way I can describe it to people who have no understanding from a personal experience. Because I look at people and I'm like, that's not supposed to hurt. Like, how do you push yourself through, like in the gym? Like, I add 5 pounds and it's like, oh my God, I'm going to die. It's like, it's 5 pounds. Like, you're not going to die. But my brain is like, holy crap. I'm like, this is not rational. Why am I doing this? But then that's the point of anxiety and an anxiety disorder or a depression. And that's the only thing that I can talk about from personal experience is the anxiety, depression. It's like that with everything. People a lot of the times know that their mental health is not great. But they have people it's gaslighting when you tell someone, well, you have nothing to be depressed about. It's like gaslighting because are you in that person's shoes? No. Like, yes, and Gail, your comment I see in the chat, but it hasn't come up in Streamlabs yet because there's about a 30-second delay. But Gail said, it's real to you. Don't say that to yourself. It's real to you. Yes. Well, part of me is like, I know from a life, like when I stress about certain things, like I know from a life standpoint, like I was stressing about the mortgage being paid this month. I know that the mortgage is going to be paid. Like, I'm rational enough to know, but my brain keeps telling me, oh my God, you have to check every 5 minutes to make sure the payment went through. And it's like, why hasn't the payment gone? Like, I know that there's money in the account we paid our mortgage with. Like, my rational brain knows that that's an irrational fear, but my anxiety of not having my bills paid and not being able to, or having my house taken away is so overwhelming that it overrides my rational self. And that's the like that's the like, I know my logical side of my brain says it's irrational, but the anxiety of and the it overrides my rational self. And that's where it's like, it's the, yeah, and it's, there's this internal fight that happens every day between what is actually happening and what my brain thinks is going to happen. It's oh, hey Lexi, yeah, we bought a house, hence the new setup. We bought a house, we moved in a couple months ago, so everything's still relatively new, but yeah. And it's just one of those, like, I think it, Flashman, I think it's the end of the world when I drop my pizza on the floor. So getting
brush
back,
it off. 2-second rule.
getting back to your story, you show up in the hospital. The nurse, is that the first nurse that you encountered there that told you to stop crying?
And I've been there before, like a couple times before, and I'm gonna say they used to be somewhat 5-star, place to go. My family member actually went there first, and now they're, down to 2.8% on Google, and I will probably go over the reviews like over the past year, 5 years, but it seems to be a thing with this place. And
how did you respond when she told you to stop crying?
I didn't really listen to her. I was in, I think, a psychosis at this point, and I just couldn't stop for a good 45 minutes. And then I was just like, I got it clicked in my brain to just, okay, I need to go to sleep before labs. They usually wake you up at, 3 o'clock, 6 o'clock, somewhere between that.
And there's reasons for that. Coming from someone who worked in acute care,
Yeah.
they wake you up at all hours of the night. Phlebotomy starts their shift at like 2:30 or 3 a.m. That's their first shift, is like 3 to 10 or 3 to 11. Because the earlier they get your labs, the earlier they can get your results, and the earlier the doctors can do something about it. So it seems very inconvenient, and it is. However, there's reasons. Like, for playing devil's advocate, I'm not a huge fan of the medical industrial complex, which is why I don't work in healthcare anymore. However, some things that are so inconvenient to patients, there's reasons.
And especially somebody that has PTSD, I'm like, you guys are gonna wake me up.
As long as your anxiety is not over the roof, you're good.
Yeah.
Sorry.
And the other thing is, they were having me sleep on basically a canoe or a cot on the floor, because they had actually no room for me as a patient. So that first night I had to sleep on a cot on the floor. So I let the roommates drift me off to sleep. Luckily, I was able to calm down and get a little bit of sleep. And then,
at this point, had they given you any medication to help you calm down, or just said, here you go, relax?
Nope. And my blood pressure during that 45 minutes was stroke high.
through the roof, shall you say?
Through the roof.
Or over
And
the
I
roof.
really hate saying that after.
I just find it funny. And like, whatever you think, whatever side, I always say, whatever side of that particular case you were on, the sound bites has been like, okay, to raise money. If I was Lynette, if I were to raise money, I would merch the crap out of that. T-shirts, like my anxiety's over the roof. You know, my like my car died, it didn't die. Like I would just merch the hell out of it. Like just my personal opinion, just yeah. And Unhung Hero, thank you for the $2 super chat and also the 5 gifted memberships. Here, you're getting an appointment with a GP is a 6-month wait here. Yeah, it's always there's a lot of problems, and there's the thing is I feel like people try to come up with easy answers, like, oh, we need government healthcare. The VA is government healthcare, and it still sucks. So, like, be careful what you wish for. There are no easy answers to this conversation.
And as a medical massage therapist for almost 20 years, I was like, oh, it would be great to have insurance cover medical massage. And I regret every moment of it because it affects me financially and it affects my patients' quality of care because you're restricted on time and quality. And if I could go back and tell my, professional self, you don't want to do this. You're going to have happier patients, if they are able to receive quality.
And people don't realize that private insurance is yes, I agree it's a problem. You have non-doctors making and not saying that doctors know everything, but you have non-medical professionals telling medical professionals what they can and can't treat and how not to treat it. But the thing that the general population doesn't realize is that part of the reason I hate the government is because all of these most of these, I can't speak for all of them, but most of these insurance companies take their guidelines from Medicare. So when Medicare makes a change, then the private insurance companies make a change. Therefore, it's the government's fault. So the government is not the answer because it's the government's fault that this got the way that it did. Because when Medicare makes a change, everybody needs to follow, or everybody tends to follow Medicare. So we're just going to use United. I don't know United. I don't have any friends there, whatever. I'm just using them as a major Blue Cross Blue Shield. They take Medicare guidelines for what they cover and don't cover. Medicare is the government. So it all leads back to money and the government. And I agree here. And yeah, Spawn Troopers in here like a wrecking ball. So getting back to you, since we take these tangents, that's why I just wanted this to be a conversation, because when you and I talk, we kind of go wherever the conversation leads us. And as pointed out, I am not a journalist, nor do I want to be considered a journalist. So asking questions and getting answers, I'm just asking questions based on my own personal interest and things that catch my eye. I don't have a list of questions like a sit-down interview. So we go where the chat and the conversation takes us.
Yep. So the next morning I see the practitioner, nurse practitioner, in person, and she...
Oh no, we lost Sarah. Uh-oh. Hopefully she'll be back. Internet issues kind of, are a thing. But let's see what Sarah's stream or her sub count is up to. When she comes back in, I will add her. I am not a CNN reporter. She is up to 92 subscribers. She needs 8 more to hit 100. 8 more. I know y'all can do it. I am not A CNN reporter. No. That's because insurance companies want to save money but take all the premiums so they can to make money. Yeah, and that's the problem with for-profit healthcare. And really, you're not as squid. Hey, Adira, how are you? I agree with you that people need to take your comment from earlier about people need to take more accountability for their own health. I think that's a larger problem in society, is people not taking accountability for anything and always putting it on someone else's. Let's Talk post link. Her link is pinned at the top of the chat. Her link is pinned at the top of the chat. And Flash fan, I recognize the dare from AJ's chat. It's but I'm not really a squid. Like, I am a human. Funny, I know, right? How that works. It's just he will distract you, not more than anybody else does. But I will see if I can get Sarah back on the we'll see. Oh no, I'm not a cat either. Yeah. I just sent her a quick message. And Spawn, people need to start eating healthier and also remember to use natural training to keep themselves fit. Walking 1 mile. Yeah, parking farther, as stupid as it sounds, parking farther away at the grocery store. If you only have 1 or 2 bags at the grocery store, instead of bringing your cart all the way out to the car, put the cart away and carry those 2 bags. It's the simple things. You sub to Sarah? Yay, she's back.
Sorry, I don't know what happened.
Oh, no, it's fine. I get it. It happens. Before I got this new internet, it happens to me all the time. So,
I'm here. As I want to say,
I am not. But we will have to look that up.
This takes balls.
It does. It does. You're up to 94. 6 more. Come on, people.
Yeah.
Like, Sarah, now you have a Welsh stalker. You're welcome.
That's good. I need a little.
It's streams like this that make us not feel totally alone. And I know, and that's kind of the point. And like, yeah, it's a conversation and she has so much more to tell. But that's why you subscribe to her, so you get everything. So we're getting a general overview.
Telling everything, because this shit should not happen.
All right, getting back to your story. You were next morning.
So the next morning, saw the nurse practitioner, and within 5 minutes, that's a problem. I was given new medication and disregard concussion. The night prior, having blood pressure sky high and sensitivity to medication. 3 things, very important things. They put me on doxepine and for sleep. Oh, and then there's a 4th thing. I forgot that I had a genetic test done that was recommended by this facility back in 2018. So 4 things that, they failed me. This could have been prevented. This fiasco could have been prevented, I think. So then I saw 3 doctors in a course of 3 days, 4 days. And each one of them, 2 were in person. The favorite one, who was military, knew a lot about PTSD. I felt like he did the most helpful, listened to me, didn't make the changes, listened to me that I wanted to wait until I saw this nurse practitioner on Monday. So kudos to him out there in the world. But the other psychiatrist laughed at me and told me that I'm an adult. And after I asked him, I'm hypersensitive to medication and I need to do microdoses of whatever, let's lower this. I feel like I'm biting my tongue. Which was another indicator that I was having issues. Now, there's a difference between my anxiety, I can't stop, and then there's the difference between medication sensitivity, anxiety-induced psychosis. So there's 2 different elements, and I can feel the impact with medications pretty quickly. So he laughed at me. He was like, "You're an adult." Yeah, I know. It's phew.
If you ever have a doctor that laughs at you and you didn't tell a joke, this is life advice. Life advice from squid with chronic pain. If you ever have a doctor where you are not joking around with them and they laugh at you, find a new doctor.
Yeah.
Just say, "You're fired. Next, please."
Yeah. 2-minute visit with this guy.
2 minutes. Yep. And the more
2 minutes.
thing about the way doctors get paid is the more patients they see, the more money they make. So it's an assembly line.
And he wasn't he was talking about other patients on a, recorder or on the phone. I don't remember exactly, but talking to insurance. So he wasn't really, like attentive to my condition anyways. So I was happy to walk out if I needed to. And looking back, I'm like, I wish I had, I wasn't so impaired and medication wasn't impairing my judgment and stuff, that I could have just, that night, I should have called 911 and had the ambulance come and get me. But I didn't think of that at that moment. So,
and that's
wait
always
for some cuteness. Oh.
Cute interruption.
So then there was a patient who was very sociopathic.
That's always
She was
fun.
18, but she wasn't allowed to smoke. So she was getting her privileges taken away and started slamming all the doors in the unit. And it didn't really faze me that night. But she did cause 2 other patients with PTSD and seizures, actually seizures. Aw.
Kiss. Mwah. Sorry.
You're in love. So yeah, she caused them to go to the emergency room.
Oh,
But
and
the
that's
next day they returned. And then I was in the day room and trying to get some water or whatever, and I was coming out and she was like, move. And
what?
door in your face. So she slams the big old door in my face. I had no time to react. I'm medicated and impaired. So if the doctors had intervened 3 days prior when I was admitted, that would never have happened. And they were going to use that story to diagnose me with conversion disorder. And conversion disorder has been changed since 2013 to emphasize the physical aspects of FND.
Had you been diagnosed with FND at this point, or was this just
No, not yet. Like they nonchalantly sat down with me after 3 weeks at the rehab. I quickly got, sent to the ER and then transferred 3 hours away from family and my support. Denied mental health services. There's a big difference between chaplain and mental health therapists.
Yes.
And so I had basically this side of my body gets paralyzed when I have an episode. And
see, and me being me, not a doctor, but like that's where I'm like, okay, it's not just a mental health thing when you start having physical symptoms.
Yeah.
Like to me that would be like there's something in the brain that's connecting the physical and the psychological together, and I need to look there.
Yeah.
But y'all know I love my brain book, so
yes, I always see it in the background.
I need to start reading it again. It's followed up by my lymph book. My lymphedema book is right behind it. So those are the 2 books that when I read textbooks, those are the 2 books I read. It's just one of those like, how if I'm not a doctor and my brain can go, okay, yes, there can be some physical symptoms with, like, say, depression. You get fatigue, you get, random pains places, but like it doesn't always happen, and it's different every time. If it's the same thing every time, my brain says I need to get like an MRI or I need to get a CT, and we need to like figure out what is that would where my brain goes. And if I'm not a doctor and I can figure that out, why can't doctors? It seems like common sense to me, and I don't. It just dumbfounds.
It just seems like the healthcare. There's no common sense.
That is true. That is true. In the military, we learned this phrase: "Keep it simple, stupid kiss." And it's like when in my experience with patients, because I've had patients where like they all of a sudden start having pain, and I need to do some not diagnosing, but like, is this something that I need to get the nursing staff to help me with, and they need to call the doctor and get something done, or is this something that like we can work through? So it's like, that's how my brain works, just from an OT perspective. And like, okay, my patient's having pain. Is this chest pain musculoskeletal, like I've worked them or made them reach a little too much and they pulled a muscle, or is this like referred pain from something else, or is this something new where I need to get nursing staff and they need like a patch, they need to go to the ER, or kind of thing. It's if my brain works like that, I don't understand why other people can't either. Like, and Flash fan, no, you don't need Dr. Squid, because Dr. No.
Anyways, so she was psychotic. She was like picking on people that day, and I was like her person that day to pick on. But I'm like sitting there trying to watch TV, talking to new friends, paramedic and firefighter, who I made friends. I make friends pretty quick. Can't help it. So I'm sitting there and I'm like, my face is starting, I feel like I'm slurring my speech, and my face feels numb and twitchy. So like, this is what happens when I have an episode. And I felt like there was like numbness in my hand. And so I go to the nurse and I'm like, I don't know what's going on. I feel funky. She took my blood pressure, said my blood pressure was a little high. Here, I'm going to give you something to help with either anxiety or blood pressure. And then come back after you get some fresh air. And I go outside 45 minutes later. She said, come back and we'll reevaluate, see your blood pressure, which was, again, sky high, stroke high, should have been intervened. And 45 minutes later, my life changed. I've lost everything. My career, my apartment, the ability to drive. Now I'm not only getting discriminated, for jobs because I can't drive. I rely on public transportation. I have to, in public, you'll see me walk with a walker. I'm trying to get another mobility device that would, help me prevent, episodes, and there goes the makeup. I had to wait for a year to get SSDI activated. And if you need somebody to, get your SSDI, I have tips on getting,
the government's slow to give you money, but really quick to take that shit back.
Oh yeah. And I can't work physically, and it's surprisingly how many things involved physical aspects of working. Even this, getting up, getting ready,
Getting up is the hardest part. I'm not gonna lie, this morning I did not want to get out of bed. Like, I did not want to move. It's so hard to, because it's like you're not only exhausted, it's like you wake up and you're like, when I sit up, am I gonna get dizzy? Is it going to, like, am I gonna have a headache when I sit up? Is it gonna be fine? Or is my back gonna hurt? Like, what there's all these questions that I ask myself before I get out of bed. Like, what is today gonna bring?
Yeah.
And it's like, I joked on my Facebook the other day. I was like, 4 a.m. thoughts, because I was up. Brain, okay, I'm ready to go back to sleep. Eyelids, I can't stay open anymore. Body or central nervous system, okay, we don't have any pain. We finally found a position where we're not in pain and we don't have a headache. Because if my neck is positioned the wrong way, I get a head rush. In bed, like laying down. You're laying down, you're supposed to be comfortable. But if I'm like this, I get a headache. Make it make sense. And then you finally get comfortable and the bladder is like, nope, you got to start this process all over again.
Yeah. It's a process.
And it's just, you never know what the day is going to bring.
Yeah.
And it's just people, this is the thing that, like, people are like, okay, you have chronic pain or you had a stroke or, you need a walker to walk. It's like, yes, but I need a walker to walk, and I can walk 500 feet today. Tomorrow, I might have a day where I can only walk 50 feet. Like, it's not, or tomorrow I might have a day where I can walk 1,000 feet and I don't need a walker. Like, every day is different. And you never quite know what the day is going to bring. So getting up every morning is a crapshoot.
Yep.
And people are like, I get up at 5 o'clock every day and I'm good to go. And I wake up refreshed. And I'm like, what is it to wake up?
Good for you.
What is that like? Because I wake up every day and I'm like, thank God I'm alive. But at the same time, it's like, what does today bring? What pain am I, like, I plan to go to the gym today. Is it going to work? Or am I going to put my shoes on, sit down on the couch and fall asleep because I can't stay awake anymore? Like,
now, I do have a question. Do you know about FND?
not a lot. I know enough. Like, I know a little bit, but I wouldn't say I'm a lot because I never worked with anybody that was diagnosed with FND. So if it was kind of one of those things, if I didn't work with it, I studied things that I worked with. And then when I got a diagnosis that I'd never worked with before, I would go home and look it up and try to figure out what, but I never worked with a patient with FND, which is what makes your story even more fascinating to me, because I never worked with CRPS and never worked with FND. So
see, I worked with a lot of fibromyalgia, and a lot of the pain that I experience is very similar to what I think is fibromyalgia. Then I've known about CRPS because I have a good friend of mine that is also a medical massage therapist, and she suffers from CRPS. So, and it's kind of amazing how, medical world evolves, and this is a new, thing, and then something else comes out, and then now FND is, evolving, I think. But also, I research a lot, and it just seems like now FND has been a thing, and like a lot of YouTubers out there, some of their content is like anywhere between a year and uh, I've seen about 8, 9, 10 years old. And so that's the good thing that I'm doing these lives, because I think we need to bring it back to light, and
awareness is a huge thing. Like, if you're not aware of that something even exists, how you can't advocate for people that might have it, even if you don't. But awareness is like, that's where I think the mental health, like, we shouldn't be ashamed that we have mental health issues. You should embrace it and learn from the people who don't have mental health issues. Should take that opportunity to, somebody's different from me. They look like they're fine. They look normal. Everything looks fine. But there's a lot that goes on that you can't see, especially with neurological issues, with the exception of a stroke or spasticity. There's a lot that you can't see, especially the chronic pain. Like my arm, I always use the thing of the other day when I went to the gym. People were saying, well, you went to the gym, you had a really bad pain day. Why'd you go to the gym? My pain is not physical. My pain is neuro. It's nerve pain. Like, you're going to have pain whether you work out or not. And actually working out sometimes helps because it gives me a different kind of pain to focus on. My muscles get sore instead of my nerves being hyperactive. So I just think that that's one of the reasons, like, I love talking to people, and I just wanted to have a conversation, is these things that people might be going through and they don't have a diagnosis yet. I'm like this, like I said, this is not medical advice, but you can go to your doctor and say, hey, I heard this, or I saw this. What do you think? Some doctors, if you have a good one, will be like, well, we can look into it. Some doctors might have said, I've never heard of that. And then there's a couple of doctors that, like, I had a patient with lymphedema. Before they got their lymphedema diagnosis, they had Googled it. And I don't recommend using Dr. Google for, everything. Yeah. But when you see something on Google and you're like, that looks exactly like what I have, maybe I should let my doctor know and see what he thinks. I don't encourage Dr. Google. However, Dr. Google can give you ideas of things to discuss with your doctor. Because sometimes you're like, I have this pain, but I think this is normal. Everybody has this pain. Like, everybody's elbow hurts when they wake up in the morning, or, everybody gets a headache every day. So you don't bring it up to your doctor because you don't know that it's abnormal, because that's your normal. That is what you live with every day. And people don't, when people live with that every day, they don't and at least I didn't, they don't understand that this is not supposed to be happening. So when you see it, it's like, oh, maybe I should talk to my doctor, because that's not normal. That is abnormal. I'm not supposed to have this pain every day when I wake up. Like, it's something to give people ideas to discuss. It's doctors that will listen to you that is the hardest part. Because the doctors will be like, well, you looked it up on Google. Like, you act like you're smarter than me. It's like, no, I'm trying to figure out how to discuss issues with you. And I didn't know that I even needed to discuss this with you, because I didn't think it was an issue, because I thought that this was how everybody in the world is. I didn't know that I was different.
My mom, she passed away, heart attack. But she had colon cancer, and I want to say 8 years prior to her heart attack. So I say get it checked out if there's something that is out of the norm for you, because you never know. You never know that, that pain in your shoulder or hip could, lead into something. So get it checked out.
It's one of those. So this experience of being in this hospital, is that where you got your FND diagnosis? They were starting to actually look at things, or
they sent me to the ER, and then I got transferred 3 hours away. Went to the rehab. They denied me a sling. My shoulder was starting to sublux, and it's very easy for your shoulder to sublux when you have.
So, for those of you who don't know, shoulder subluxation. Here's your shoulder blade. I was going to say scapula, and I'm like, no one's going to know what the hell a scapula is. Here's your shoulder blade. Well, there's a certain part of your shoulder blade that connects with the head of your humerus, which is this arm bone, and there's tendons and ligaments that are supposed to keep everything, the muscles together. The bones and the muscles connect, the bones connect to each other. But when your arm is not working, say in the case of a stroke, if you don't have support keeping that joint in place, it starts to separate. And then when you move, you get impingement, ligaments, tendons, nerves, your muscles get crushed when you move. Because instead of having this nice fluid movement, you have this like disjointed, and things don't work like they're supposed to. Think about like it's supposed to be this nice ball and socket, and now you have all this stuff that's in there, and when you move, it pinches and it hurts like hell. And it's also hard to fix.
Yep.
So like that's the first thing I would do with my patients that didn't have arm movement is I would tape their arm, just so when we were working on movement it's one of those things that is also very hard to do. It's very hard to support that joint. Say, yeah, you use a sling, but now you've restricted the whole arm and you can't work on getting that function back because you've restricted the arm.
And I knew that I only needed a temporary solution, during the day, rehab, just to give it a little bit of a break and support it for a little bit.
I like my
I wasn't gonna wear it 24/7. I knew that I needed to be taped up, and
like I said,
that's the thing. I'm a medical massage therapist. I told them I'm a medical massage therapist.
I'm not.
I want to, keep my career going, and they didn't care.
That's crazy to me, because that would be like I told my surgeon, I'm like, I'm an occupational therapy assistant. Don't treat me like I'm stupid, and this relationship will go a lot better. I will not be a difficult patient if you stop treating me like I'm stupid.
Yeah. And I even was like, talk to me in medical terms, because I'm going to know what you're going to say and do and all that. And I was just another number and another patient. And
I hate that mentality. And the problem with therapy too is, especially in subacutes, productivity is like 95%. So you have to be 90% productive during your day, which 90% productive was what the standard was when I was a student. And my clinical instructor and I did we did a little like what does 90% productive look like? It means for every hour you have 4 minutes to pee, drink, type. You have 4 minutes, and you either type your note and stay up on your notes and your documentation for the day, or you pee. You can't do both.
Yeah.
So that's another and
then they didn't give me I was developing contractures.
It makes me want to be like, this is like every time someone says contracture, I like stretch. I'm like,
yeah, that's where I was going with that.
Like, let's go opposite. Like, let's not, yeah. Because I see people like this all the time, like in walking down the road, and I'm like, okay, let's like squeeze the shoulder blades together, chest up, head up, neck back. And yeah, I give myself a double chin, but it's keeping the neck over the shoulders. So when the head goes forward, the shoulders start to go forward. When the shoulder goes forward, the back goes forward. And then you're like,
Granny.
You can't reach anything on a shelf, not because you're not tall enough, but because you don't have the posture. And it's like, here's full range of motion. You still can't reach something on a shelf, or now it's like here. Everything comes from the core. Hi, baby. What's up? Okay, I'm getting you. Hold on.
So
Girl, I can't pick you up like that. You're heavy.
So they did not give me a hand brace for the contractures. They were like, here's some Aspercream. Yeah, if anybody screenshots my facial expressions on, oh my god, Aspercream, yeah. That stuff is nasty. I hate the smell of it. And then you can apply this to your leg and your arm or whatever to help with that. And then they started giving me
She's your biggest cheerleader.
How many milligrams of muscle relaxers they were giving me? Maximum dose of methocarbamol. Yeah.
And you said you were already sensitive to medication, so now they're giving you the max dose of a medication you're sensitive to, and it's still not working. Something else is wrong. I'm always like, my thing is if I'm on the max dose and it's not working, one, either this medication isn't effective for me, or two, there's something else going on besides what this medication is for. Just a Flash fan said contracture isn't that a term for being pregnant? Gail is Flash fan, that's a contraction. A contracture is where when you don't have the muscle tone, your tendons and ligaments start to tighten up because you're not moving. That's why we say motion is lotion, because the more you move, the easier it is, because everything stays how it's supposed to. When you lay down and your hip or sitting, the perfect anatomical position is upright, hands out or palms forward. Upright position. When we're sitting and we're sitting for long periods of time, our hips get short, and that's why when we stand up it hurts, because we're so tight. And it's like it's one of those, like, when you don't have the muscle tone in order to move your hand, you start to get like this. And part of therapy is just, there's two sides. I have a Brunstrom's theory of movement on this shelf somewhere, which is a book on strokes. It's a stroke rehab theory. But it's like there's two aspects to it. It's maintaining the physical, like keeping your body in its supposed to natural anatomic position, like preventing the sublux, preventing the contractures, but then working on the strength and the movement. And it's combining those two into a, like there's a a phase. It's like you get movement back, but you have contractures, and it's like you're there's this two-phased.
See, if my family was close, they would
advocate.
Let's go down to the gift shop or pick out something. Let's go grab. There was like a Starbucks or a restaurant in the hospital. Let's go get a bite to eat. They would, let's go practice walking. Unfortunately, nurses were too busy. they didn't have the authority to take me outside. I hadn't gone outside for 3 weeks.
And this is what you're telling me is things that happen to you versus what I would do if you were my patient. Most of my patients, because I knew when I worked in the rehab, because I worked on acute care, but I also worked in our rehab unit. And when I worked in our rehab unit, the first thing I would do was ask a doctor for a order to take you off the floor, because we had a garden, a healing garden up on the 8th floor of our tower. So I would take patients up there and walk around. I would take patients outside because we had a patient garden for our rehab unit outside, and I would have them pick, some people would plant, as the year goes on, some people would plant as their activity. Some people would like weed eat, and then we'd pick beans when they were whatever we had grown, we'd pick them. The first thing I did was ask for an order. So now the nurses can't use the excuse, well, we don't have the authority, because the doctor put the order in there when you first got to the floor.
Yeah.
So it's like, this is what you're telling me is like everything that and this is what I did during the whole Maya Kowalski trial when the PT and the OT were testifying. I'm like, that's not what I would do based on when I worked in acute care. Like, that's not what I would do when I worked in rehab. Like, I just put myself in the position of the patient and been like, would you want to be cooped up in this clinic all day long? No. Let's get outside. Let's go walk outside. Let's.
Then the muscle relaxers weren't really helping. I had it didn't affect me even on the max dose. So they decided to try giving me unrecorded medication.
Whoa. And this you had mentioned to me before, but when you had just said that they didn't have the authority to go out to take you off the unit or to allow you to go off the unit with anybody, however, they could give you medications that weren't ordered for you. That to me is
Let me backtrack. They gave me something for pain. And I even questioned the nurse. It was going to be through an IV, and I was like, I don't remember even talking to the doctor about this, which this nurse, who was one of my favorite nurses through this whole thing, and unfortunately, he only got to treat me once after this happened. So he had like 20, 30 years of experience. He was like, I'm kind of scared. I'm going to call the doctor and verify this is for you. So the doctor convinced us both that it is for me. So I was like, I don't know. I don't remember talking to you about this. And so I was like, and when you have a stroke, make sure you have a POA, or if you have any medical issues, make sure you have somebody on your side to advocate and, so I just went with it. I'm like, it's for pain. Maybe it'll help with the contractures. He administered, and it was instant. I felt like I thought I was going to die. If you say through the roof, I felt like my body was on the ceiling. And I was fighting it. I was like, I feel like I'm going to die. And I could vaguely hear during the seizure, They told my sibling, who was my POA, oh, she's just having anxiety.
How do you misdiagnose a seizure? Just, I don't know. Maybe, like I said, maybe it's just me. The hospital I worked at.
Into an instant seizure. Whatever they gave me, I can't find it. Any record of it in my portal. Now, did that cause this FND? No. I think this was a one-time occurrence. This did not cause reoccurring seizures. They denied me of mental health services. I lost my apartment because they were using the outdated conversion disorder. It was getting seen as just a mental issue. So they weren't going to, they recommended that I go to a 30-day rehab center with skilled nursing because I still couldn't shower on my own. I still couldn't do, basic living. So because of that, I had mental health issues. They kept coming back saying that I'm too young. I have mental health issues. And then I lost my apartment.
And they always come up with excuses as to why they are, why. And I understand keeping it simple, so you rule out those things first. But like when you've ruled out those things and now you're still having those issues, it's like living in their home.
And to make it worse, I had nurses and OTs hitting on me while I'm in the bathroom, naked. Yeah.
That's awkward.
Yeah, very awkward, unprofessional. So had that, and then like if I had my family member who, my sibling who was a POA and who was a nurse themselves, this wouldn't have happened. This whole thing.
My heart goes out to you.
Happen. I never dreamed that my 7 to 10 day would turn into 3 months. Fiasco. So luckily, I, being an entrepreneur and living in a small town, I knew everybody. When I moved here, I established with I think I have every realtor known to man in this town. Known by face, name. So I had a lot of connections, living here for the past decade, especially when the family member attempted suicide. And so I contacted the homeless shelter. I didn't really qualify to stay there, but They opened their doors. They had a little respite area where they take in people that, especially elderly, that have lost, pretty much everything, and they have nowhere else to go. So that place, I would love to, donate some of my funds to have, instead of bunk bed style, have ADA approved beds and some other, linens and stuff. So, I would like to donate my time and, being a support, once a week or whatever, specifically to these, individuals. And so I didn't have, I get transferred. They take the waffle away from me. I'm strapped in a wheelchair in the back of the van. And that's a painful ride. And, the day before discharge, the doctor nonchalantly, here's some basic exercises, and you have the conversion disorder, and good luck. That's basically what she said.
Misdiagnosed. And the thing that gets me about what you said is that they say it's all mental, but weren't giving you any mental health. Like a psychologist wasn't seeing you. They didn't recommend a psychiatrist.
Yeah.
Like they didn't send you to your general. Like
I only saw the psychiatrist there twice. The first time, he never introduced himself. My doctor had him come back, forced him to come back and introduce himself and apologize. That's really unprofessional and sad.
Yeah.
And kind of scary too, that you're all around. They should have, okay, she's been on this medication for 3 days at this hospital. Let's just either remove it or taper her off and see if her condition improves.
Would you like to go color?
No.
Once I was off of it, a lot of symptoms improved.
Interesting how you improve that. Like sometimes it's like, what's causing your issue? Is it truly you, or is it like medications and treatment that they're giving you that and side effects of that cause other issues? And that's why it's like, I hate medications. I have a whole boatload to take every morning. Well, some I take vitamin D and stuff too, but sidetrack.
And then they told me, you can either contact your private mental health therapist or see contact somebody outside the hospital. You can't do that, when you're inpatient in a hospital. They need to be providing that service.
Yeah, and there's we can go down a whole rabbit hole of like issues with individual providers and them thinking that, see, I'm always the kind of, and I keep going back to the medical side of things, but when there's a reason that I say when I don't know something, I don't know something. I'm not afraid to admit when I don't know, because to me, that's not everybody knows everything. Doctors don't know everything, but the key of a good therapist or a good doctor is saying, I'm not comfortable with this, or I'm not skilled with this. Let's find someone who is. because you're not paying
And that's
yourself
the
in this
problem.
program.
I felt like my brain is still impaired. Like, I can't make those decisions. That's why I was like, I told my sibling, "You're my power of attorney. Send me whatever paperwork or whatever needed. And let's, you're gonna make my decisions. Until."
It's just one of those. There's no, like I said before, there's no easy answers to anything. Sorry.
So I stayed at this homeless shelter for a day, and they usually have, doctors come in, do you need some basic, care, get you, your medicine if you need somebody to go get your medicine. And they failed to give me these psych drugs. Thank God. But I had to follow up with my own primary care physician the following day. Well, my primary was notorious for, jumping ship, and here's another practitioner, colleague. So this colleague did not have time to look at my records. She was like, "I kind of know about conversion disorder, but I don't feel comfortable putting you on anything new or managing, or even you're." And I was about to, have another episode. This is when I started having these conversion non-epileptic seizures. And she mandated that I return to the hospital and start all over.
Oh, that'd be a giant negative.
Yeah. I was like, I couldn't make decisions. And well, went there, and I was like, okay, they say it's mental, get on some new medication.
Angel, please stop that. Thank you.
This hospital then tries all sorts of medication. This is when I start seeing a psychiatrist via telehealth for 14 days. The average stay is about 7 to 10 days.
And you were there for 2 weeks.
2 weeks. 1 shower.
In 2 weeks.
I only got 1 shower because I needed assistance. It wasn't very long before I started losing all function of my body again. I walked in there, I was like, okay, if I have to do this in 2 steps, I still need physical therapy. And obviously this is mental for me. Not everybody with FND. It does not mean you have, psychological trauma, it can be either or both. So unfortunately, I have both. So I literally sat down after I was admitted, and I think it was because I sat in the same spot that this all started and triggered me to lose everything again. And it,
She's sitting on her iPad and wondering why it shut off. Like you're sitting on it.
doing butt calls. He's so darn cute. So sat there and lost everything, and the nurses and staff would joke, "Oh, you were walking just fine when you were admitted." So I had other patients sneak me in to assist me. I ended up having to be crafty and urinate on the floor.
Oh no! Oh no! Oh no!
There, because the staff were too busy.
Yeah, you tell them how BS that is.
Thank you, ma'am. What would we do without kids?
It just sounds so awful. So awful. Like I read your first email and I had to read it like 3 or 4 times to like comprehend everything that I was reading.
And I apologize if
it's not your fault. You told me your story and it was like it was not like I didn't understand it, but it was like I had to read it to make sure that my brain was like, actually, this is kind of like a double take, but it was like a triple take or a quadruple take. I was like, it had to sink all in. And this is before you even got the diagnosis of FND, not to mention anything that goes and the challenges that goes along with that, which I would say we can talk about that another time. But if you want to hear about that, go subscribe to Sarah on her channel and you can hear it from her without me interrupting at all. You can discuss that with her. Right now, you're up to 96 subscribers.
Come on, guys, let's go.
3 more.
Let's go. I want to go eat.
Oh, Jeffrey, they're not cutting your meds. Here, just to answer the question that you've been asking in chat. They're not cutting your meds. They cannot give you your medication like your Angel. So say this is my bottle of medication. They can't give you your medication. They order the medications that you are taking, but they cannot let you bring your own bottle of pills into that facility because they don't have time to test to make sure those pills are actually what the bottle says they are. And in order to prevent lawsuits of say you have drugs that aren't the drug on the label, and you go in and take them and they interact with what they decide to give you, they could be liable. Or if somebody else or if other patients get your bottle of medication.
So it's not that you can't take nurse when I was first admitted.
Yeah.
You know what she said? I should have brought my medication with me.
Jeffrey, they always have the medications because they go through a pharmacy. So as long as a general pharmacy has it, and pharmacies generally have all, if they don't have that medication, they have a generic version. So, or if they don't have the generic version, they give you the real version. So there's always an answer. Like it's not, you will never have an issue where they can't get your medication. Because medications aren't pharmacies don't gatekeep medications like Lyrica, for example. One pharmacy won't have Lyrica and the next pharmacy will. Like all pharmacies have all medications. So yes, and Yeah, Jeffrey, they have no way of knowing what the pills are. It's a big legal issue. You still get your medications, but they don't give you your bottles. Like, you can't take your medication. Say, like, I wake up and I go to the kitchen and I, get I have a pill, like a dispenser, because I take like probiotics and vitamin D and, all that stuff. So I have it all. So I just have to take it all. I don't have to open bottle after bottle after bottle. And I go to the kitchen and get it. You can't do that. A nurse has to come around and dispense your medications to you at certain points of the day. So Baby's going to make a great lawyer when she grows up. Tells it like it is. No sugarcoating. Yeah.
No.
Yeah, you tell them, like, no, this is not acceptable behavior. And if you work in healthcare and you are seeing that, like, you are seeing this and you have seen this in your facilities, say something.
Yeah.
Because this is not an acceptable way of acting and treating people. Like,
I know some other FND warriors out there that are getting deliberately pinched, like bruised, and this.
They generally prescribe, or they
never
generally
happen.
do their own.
No.
Yeah.
No.
So this all happened, guys, before she even got diagnosed. We haven't even gotten to the diagnosis. We're at about 2 hours, so I have to get going. But this is like, if you want to hear more of Sarah's story and talk to her and have her answer your questions that you have, she does lives almost at least 3 times a week. How often are you streaming these days?
I'd like to get to the point where I talk about my own Lynette story. So
you have
please come follow me.
You have a Lynette of your own.
Thank God we got her evicted, and she's still out there telling, stories about, how I'm faking, and yeah. So if you're out there in the world, in my neighborhood, watch out for her.
Hey, Denise, I just got here. What are we discussing? This is Sarah from the channel Livin Life with FND. We are discussing, because I have chronic pain. I had a Chiari malformation, which caused me chronic issues for I don't know how many years. I didn't get diagnosed till I was in my 30s. So we're discussing what happened in Sarah's personal journey. This is a series that I've wanted to do for a while, of talking to people who have chronic issues, chronic pain, kind of letting the world that doesn't have these issues, because surprisingly, there are people who don't have any pain at all on a daily basis. I don't know what that's like. Somebody inform me, but to try to inform the general public who doesn't have these issues that people they look fine, but so someone has a handicap sticker in their car, for example, or a service animal. You can't see what their issue is, but that doesn't mean they don't have issues. And just because they're good today, yesterday might have been a really bad day, or tomorrow might be a really bad day. And also letting the chronic pain people and the people who deal with issues such as this every day, that there are other people around you, that you're not alone. So it's kind of a twofold kind of, and it's just conversations. Like, I'm not interviewing. I want to hear people tell their stories in their own words. I am just kind of guiding the conversation to make sure that, like, and asking questions of my own. It's one of those, like, this is such a prevalent issue, especially now, with healthcare being on the, with everybody hating healthcare and everybody hating on insurance, how we got to this point.
Yeah. And
because
medical
gaslighting is real.
This this has caused me to, every time I was like trying to tell this story to any new practitioner, anybody, I would have an episode. To the point where I couldn't tell the story, and that's the other reason why I am doing this on YouTube, to have a place to dump it and coax me to tell the story, because I felt like I was stuck, you know, and I needed a place to, you know, that I could just, release all this trauma, and I was
Sometimes
finding my own private mental health therapist. I was still getting stuck, and
sometimes YouTube is the
my
best.
family has already heard the story 10 million times, and and it was just creating issues, and I want to get over the hump where I don't have episodes.
Well, and soon with being able to tell your story, when instead of having to rehash the whole thing over and over again, you can say, "Hey, I made this playlist that has my story on it. Go watch it."
Yeah.
So you don't have to mentally rehash the whole story over and over again. Sometimes for some people that can be freeing, and in other people that brings back memories that they don't
And I
want.
didn't want to suppress it. I don't want to suppress it because later on down the line, I have a fear of, I'm going to have more issues later. So hopefully,
And yeah, I'm
hopefully
sure.
it'll be a thing.
And
Yes,
yes,
I will be back.
yes.
This
Sarah has been in my chat for a while. But when she shared her story with me, I had been thinking about doing this for months. But like, I figured the best way to kick this off, which would be to someone who's truly, truly like been there. Plus the fact that she is trying to grow her channel, and I am all about paying it forward because I did not get to 3,000 subscribers by myself. So who am I to gatekeep subscribers? I am not. That's not my personality. I'm all about paying it forward, and y'all need to go and support her because she is telling it like it is. She doesn't really sugarcoat. You're 3 away from 100. So it's
3 more. Come on.
yep.
I want to
Sarah
go
has her
out
own
to
channel
eat.
pinned at the top of the chat. She's up to 97 subscribers. Her channel is relatively new, but she has a great story and a rough story. And by sharing our stories, we let people know that yes, when we talk about medical gaslighting and someone tells you that medical gaslighting isn't real, they're gaslighting you because it is. I've told my story, and now it's other time for other people and to bring light to other people sharing theirs. On that note, I do have to get going. I do have a hard exit of like right now in order to not. For Zach told me I need to stop being a fat ass and work out. He's my personal fat shamer. So if you ever see Zach in here calling me fat, it's Zach. He's my personal fat shamer. I had to explain it to my dad when he first saw it. I'm like, everybody needs somebody to keep them accountable. And Zach jokes around with me and calls me a fat ass and gets my ass to the gym. So
we all need those.
And I have to do mama stuff. I have to make sure that she has her medicine for the day if she needs it, and we got to do lunch and stuff like that because her breakfast is still sitting here. She didn't eat it. So yes,
Thank you again for having me.
When the whole community grows, the good channels grow, and Squid has a good channel. Thank you, JKD Book. You are amazing. And no, he jokes about it, but I'm not holding him here. I don't have him tied to a chair anywhere. Like he's not forced to be here. So
If
But
you want to be
this
part of my channel, I'm doing a painting. So I'm painting squid.
This is
Mural
gonna go
down
to-
here. So let me check that out.
All right, let's do one last check before we go. Hold on. Gotta share it. Gotta share it. Gotta share it.
And you freeze. Yay! Woo!
We did it. Well, I didn't do it. I was already subscribed. Y'all did it.
Now you gotta keep going, you guys, because YouTube can be a-hole. So
yeah, YouTube will knock her back down to 98 by today. I can guarantee that. Because I've been hovering around this like 3,700. Like I go up to like 3,702, and then I'm back down to 3,698, and then I'm back up to 30. It's YouTube does this like, you know, YouTube does this every time you hit a milestone. They mess with you. Like every time you get close to a milestone.
I didn't care that day. I still celebrated. And I'm still gonna celebrate today.
Yay!
Thank you
I'm
guys
so happy
for
for you.
letting me come on here. Squid needs to get going. I need to get going. So you guys have a great day. See you tomorrow.
Thanks guys for hanging out. Thanks for subbing to Sarah. If you want more on her issues and her topics that she talks about, go check out her channel. She has 14 videos right now. Y'all go check them out. Give her some love. Give her those watch hours. And y'all have a great day.
Bye.
Bye. Let's see.